Now, let's just have a couple questions for you, and we can start with those. Now, from this new role, you already know Delaware very well, but there are some more responsibilities with this new role. So what are the biggest opportunities for Delaware at the federal level?
Sure. Well, first off, it's funny. I saw the clip from, I think, our first interview that you recently posted, where you did demonstrate your clairvoyant powers by predicting exactly what has just happened, which is that Lisa Blunt Rochester is running for the Senate and I am running for the United States House of Representatives. You knew it before I knew it, and so I won't question your predictions that you just made moving forward, although I will say I don't know how anyone can be more successful than Joe Biden. He has been, I think, the greatest Delawarean to have lived in the modern era, and I am so grateful for all he has done for Delaware. He was actually younger than me when he got elected to the United States Senate. He was 29. He was about 5 years younger than I am right now, so that's making me feel like I'm behind the curve that Joe Biden blazed. But you know, as you mentioned, I have served in a number of different roles over the last decade and a half, from working for former Governor Jack Markell and our former Attorney General Beau Biden, to working in and with the Obama White House, to serving as the national spokesperson at the Human Rights Campaign, to now, through 2 terms, serving in the Delaware State Senate, representing the district that I'm born and raised in, serving the state I love, including as the chair of the Senate Health and Social Services Committee for the last 4 years. And we've gotten a lot done at the state level. I ran for state office. I ran for the state Senate because I knew there was more we could do at the state level. And over the last 4 years, we've been able to deliver really meaningful progress for Delawareans. I was proud to help champion a $15 minimum wage. I was thrilled to pass my landmark legislation, the Healthy Delaware Families Act, to provide paid family and medical leave for Delaware workers and their families. I was really excited just this past June to pass, with unanimous bipartisan support, my Protect Medicaid Act of 2024, which will result in the largest ongoing investment in our state's Medicaid program since the Affordable Care Act was passed in 2010. So we've gotten a lot done at the state level. But I decided to run for the U.S. House seat because at the end of the day, I know, as someone who has served in state government, someone who has worked at the federal level, that the only way to truly meet the needs of all of our neighbors, the only way to truly grapple with the scope and the scale of the challenges that we face as a state and as a nation, the only way to do that is with federal action and federal investment. But in order to get that federal action and federal investment, we've got to send people to Washington who have what I believe I bring to the table, which is a proven track record of rolling up my sleeves, diving into the details, bringing people together to deliver that real and lasting progress, much of which I just mentioned. And at the federal level, we have an important opportunity to help Delaware grapple with some of the most significant top-of-mind issues that voters across the state talk to me about every single day. And that starts with and really centers on the costs facing families, the costs around housing, around healthcare, around childcare, that are simply unsustainable and unbearable for far too many workers across this state. The costs that retirees on fixed incomes are struggling with, the costs that new parents are struggling with, the costs that those in the sandwich generation, who are both caring for new children and caring for aging parents all at the same time, are facing. And in order to bring down those costs, in order to guarantee affordable childcare for every family in this state, we're going to need federal action. We're going to need federal investment. I want to bring that investment here to Delaware so we can build out our childcare infrastructure and provide quality, affordable early child education for every young person. You know, the housing costs that we're facing are a byproduct of the fact that we simply don't have enough housing stock, affordable quality housing stock here in Delaware and across the country. And the federal government can be an important partner in bringing down those costs by helping to invest in new construction of affordable housing here in Delaware. I want to bring that investment to this state. And then finally, the only way that we're going to be able to bring down the costs facing patients is with federal action on healthcare. Actions like expanding Medicare to include vision, dental, and hearing, actions at the federal level to help Delaware build the provider pipeline so we have more providers in this state. So whether you live in Wilmington or in Dover or in Georgetown or in any rural areas in those 3 counties, that you're able to access a quality primary care provider, a quality OBGYN, a quality dentist in your area at low cost. These are necessary next steps for Delaware to be a more attractive state to live, work, and raise a family. These are critical next steps in making the American dream more affordable and accessible. And we need the federal government to step up. And I want to help deliver those policies and that investment to Delaware.
No, that's excellent. So now there are a lot of opportunities, I believe, and Delaware has a lot of potentials. And I know you are aware of most of the issues in the future we may have. And then having you on this seat, to me, it's actually kind of a peace of mind. So I know that there were certain things that I was worried about before the primaries, and I'm still, but you and Lisa being in the, and Chris Coons being in the Senate, I think will be able to deal with those problems. Mostly I'm talking about the legal system. And I mean, I don't want to go into that unless you do, but it's just having right people in the right place probably is kind of hopeful for us. And I know we should be in good shape there. Now, I know healthcare, and then you just mentioned the affordable healthcare, and you are the champion of the paid family leave. And actually, that was our first session was about. So it was 2021. So, you know, what's really nice about these types of interactions, we are able to kind of follow closely what our state officials, federal officials are able to do. And we can actually measure what they do if there's an outcome from what they started, and you did it. So with the paid family leave it's important for society. So it's not just me, you, or them. It's just for our peaceful living together. This is one of those things that we need to be able to provide some of those benefits. And small businesses are always going to be in a disadvantage. And I know this is going to support those individuals through their employers, and being able to do that is great. Now, in terms of the healthcare, now having access to healthcare, as you know, physician shortage is a huge problem with nurse practitioners and physician assistants. I think we are doing a good job getting them on board. Even at United Medical Clinic, we have 3, 4 of them right now, and we utilize them in every different level. But what are the next steps that you think you are able to take to ensure this access is available to everyone?
Sure. Well, I think a couple of things. One is that for far too many people who have health insurance coverage, they still remain underinsured. They still face high premiums, high deductibles, high out-of-pocket costs that make healthcare practically inaccessible for them, even if they have health insurance coverage in a technical fashion, on paper, I should say. And so I think there's a number of steps that we need to take at the federal level to expand access to quality coverage, whether that's a public option on the individual marketplace to increase competition in the individual marketplace, whether that's expanding Medicare to cover the full range of healthcare needs that people have, as I mentioned, expanding it to include vision, dental, and hearing. I'm incredibly passionate about oral healthcare. It's been an issue that I've worked on in the Delaware General Assembly to recruit more dentists to underserved communities here in Delaware. We've actually been able to reopen previously shuttered dental clinics at our federally qualified health centers because of legislation that I passed in 2022 that has now brought in more dentists and brought in those dentists specifically to those high need areas that have allowed those clinics to reopen. And if you're a senior citizen, if you're a person who's relying on Medicare, it is unfortunately unaffordable for many to be able to purchase those plans privately to cover vision, dental, and hearing, or they're forced to choose options that unfortunately provide substandard coverage in other areas of healthcare in order to secure the vision, dental, and hearing. So there's definitely a lot more that we need to do at the federal level in terms of expanding coverage with Medicare, including continuing this president's work to cap the cost of insulin, to extend that to more patients, to continue the cap on out-of-pocket expenses that folks on Medicare have to pay for prescription drugs. We should be continuing to lower that. And I believe that when it comes to building that provider workforce here in Delaware in particular, I helped lead the charge alongside some of my colleagues to implement and improve and expand our state's loan repayment program. I'd like to see us build on that progress at the state and federal level to really help healthcare providers grapple with the burdens of student debt and to make this state more attractive for them to live, work, and raise a family in. But I also think we have to build that pipeline here in Delaware. And I've already started having conversations with healthcare providers, with the universities here in Delaware about the need for a medical school in this state. And I am interested in utilizing a partnership between the federal government, the state government, and private institutions to see what is possible, what is practical, what is feasible, and where we can secure funding to cross some of the initial barriers that have prevented us from being able to establish some kind of medical school here in this state.
I think medical school is the key. Although we have some partnership with Thomas Jefferson, Christiana, and also UPenn with the health system, it's not enough. That's at the residency level, but medical school itself is one that we definitely need. I've been actually saying this for so many years, but that's one of the things that if it can be done in your first or second term, that would be excellent, right? So, and it would really help because we have a lot of issues. A lot of physicians are retiring, so that's it's not like we don't have enough. There are a lot of people who are coming in from the residency, but a lot of them are retiring, and people are living longer.
Well, and Kamal, I think you've just hit on one of the most important issues that Delaware specifically faces. So nationwide, to your point, we are seeing the pending retirement of so many critical professionals, not just in healthcare, but across our economy. We are going to see a mass retirement in the years ahead. And we're not seeing folks at the beginning of their careers in necessary numbers to fill that void. And that's a national problem. It's a problem here in Delaware. But then on top of that, what Delaware then simultaneously faces, alongside this wave of retirements in healthcare that we will see here in Delaware, is a wave of retirees wonderfully and excitedly moving into Delaware. And so we've got a higher need population coming to Delaware and not the healthcare workforce necessary to care for them. And so we have to do a better job of meeting that population growth that we're seeing among retirees with with growth among young workers and young families, so that we not only have the tax base necessary here in Delaware to fund critical benefits and programs through state government, including our schools, but also so that we have the actual workforce necessary to provide quality, accessible care to that aging population that we are seeing, particularly in the southern part of our state.
So I think there are a lot of things that needs to be done with the state Senate and the House and the federal. And I know Brian Townsend and a couple of the people from his team, his friends, they're actually working with the primary care bills. You are doing the paid family, and then there are more to do with the Medicaid being on an ACO, economic care organization level, and bringing more Medicare Advantage programs into the state through these Medicaid. I think the access is going to be okay, while we just need to take care of the number of providers that we can provide to the system. And from that point, as you know, like United Medical ACO is the only private homegrown clinically integrated network in the state of Delaware. We are providing primary care services for almost 115,000 lives. And, I take my responsibility, my role in this extremely seriously. So I know that working together with you guys on the federal level, at the state level, we should be able to have a good dialogue to come up with solutions.
Absolutely, and it's an ongoing conversation, and I want to really highlight something that you just mentioned around Medicaid, and I touched on this before because in my first term, paid family and medical leave was a huge priority of mine. Because when we're talking about access and cost when it comes to healthcare, we're not just talking about the cost of medication or the cost of seeing a doctor or the cost of health insurance. We're also talking about the financial security and the financial burden that comes with having to take time off work in order to get care or in order to take care of a loved one. That's where that paid family and medical leave program, which will start next year, really comes into play to provide that financial security to folks through those incredibly frightening challenges in life. But then in my second term, one of my big priorities was Senate Bill 13, which was just signed into law by the governor. I mentioned this law, the Protect Medicaid Act of 2024. And Kamal, that legislation, as I mentioned, is going to result in the largest ongoing investment in our state's Medicaid program since the Affordable Care Act, $175 million annually for our Medicaid program to not only be protected for future generations, but enhanced and expanded for current and future generations here in Delaware. We're going to be able to raise reimbursement rates with this funding so that we can make Medicaid a more financially sustainable option for providers to take. We're going to be able to expand coverage to communities and services that don't yet have it, so they do have access to this critical life-saving insurance benefit that already 1 in 4 Delawareans rely on. And so I'm really excited about the progress that we're going to be able to make once that funding starts to come into Delaware.
I mean, I've been in this state for the last 25 years, half of my life. I lived here. I never left the state. I'm one of those really loyal Delawareans. So I want the best for our state. So when any policy, any politics is attacking the system itself for the state, that's a huge concern. It's a huge concern. It's a deal breaker. So
I didn't mean to interrupt, but that's 33% of our income. 33% of our income comes from our corporate intake. That's not even counting all the lawyers and the accountants and everybody else that's in this state because of it. You take out that 33% of the income, our personal income tax is around the same amount of money. So you'd have to double everyone's personal income tax, double it. If you want to see an exodus of people out of the state as quickly as we've watched many of the seniors come into the state, then do that and you'll watch everybody leave our state instantly. We just have to be smarter than this. This is the downside of this is catastrophic.
So I want to shift gears a little bit to education. And I know one of the main issues that you are going after is the education system, which is the right direction because I think it's one of the top 3 problems and issues that we have. Unfortunately, our ranking in any of the public school measurements, we are not really great. Many people, they have to send their kids to private schools. Now, one of the things that I was reading from your tweets, that we have a good funding, high funding available for this system, but somehow the outcome is not so great. What's your solution to this?
So my belief is with 19 school districts, a Secretary of Education and a Department of Education, that's not working. We have the least amount of money going into our classroom than any state in the nation, looking at our cost of living. We have less than 25 cents of every dollar of taxation we take from people, making it into the classroom for the teacher and the student. That's most are, even the next lower ones are 40-something%. Most are up around 40-something cents. The others around 60, even some are as close to 70 cents of every dollar going in. So that needs to be fixed. So to just say, oh, we need to put another $800 million to $1.2 billion into education. Okay, where are you getting that money? And in my world, I don't believe that I have to raise taxes and put that kind of money into education. I think we already have the money in education. We just need to refocus it and move it and consolidate buildings that have 30-40% occupancy rates in schools. And we have other schools that are at capacity, but we're not making them larger to bring children in. If ones are working and children want to go and they're getting good results, make them larger so they can digest more children. If ones are not working and the children aren't doing well and we're getting 3 to 5% pass rate of third graders coming out of school in 2 or 3 of the schools right in the heart of Wilmington, right in the middle of Newcastle County, then maybe we should put all those children in one school, refocus the school, bring all the resources of 3 buildings that we're wasting into one building, and then all that extra money goes to teachers. I don't believe people think that way for 2 reasons. There's not very many entrepreneurial-minded worlds or persons down there because most of them are out running their businesses. And secondarily, I mean, the elephant in the room is the teachers unions don't want that, and they've got a ton of power. That's why I didn't get their endorsement, and my opponent did. I'm not willing to say what I have to say to get an endorsement. I'm here to make Delaware better, and the only way we're going to do that is by having much better schools, because so many companies, so many businesses, so many people leave our state because our schools are so poor. That has to be project number 1. Then make it more business friendly, then figure out what we need to do to make our medical coverage and our medical environment, and work with our hospitals and our pharmaceuticals and our insurance companies to make healthcare affordable and start training healthy lifestyles as opposed to always just worrying about sick care. There's A, B, and C, and I think they need to be done probably in that first 90 days to get a vision and a path forward on how it's going to work, and bring the team together for each crisis reconciliation group to get together. And I think, you look at somebody like a Bethany, you look at I could go through, I shouldn't say names, but I can go through, there's some very qualified people out there to really help fix these things if they're empowered to fix them, and they're not having to, dovetail around because certain people gave certain donations or endorsed certain things. I don't have those restrictions. I just have the desire and ability to bring people in from all parties with great resumes to make Delaware really, really strong again.
So again, another topic that's on the healthcare, as you mentioned, one of the things that I was kind of surprised that you actually vote no for HB 350, and it has some issues, but overall, I personally thought it was going to be another way of maybe controlling the healthcare expenditure. What are the issues that you saw on that bill that was problematic?
That's a great question, and it's actually there's 2 different points. The first point is the government, the governor's office decided that our benefits do forward commitment to all the retirees in the state, both already retired, currently working, will be retired, and future working and will be retiring, was just ballooning. It was up to like 8 billion or maybe even 9 billion. So it was growing faster than we were putting money towards it. Rather than taking part of the $4 billion over the last 4 years of extraordinary income to offset it, one of the secretaries thought it'd be better to just reconfigure the benefits for all the state retirees. And that was not well thought out, and it ended up making it very difficult. So 2 years ago, my colleague Michael Smith, Representative Smith, and myself did a town hall, and we brought the secretary in, and her explanations were not met very well. So it got delayed. It got stopped by the courts, and then it also got stopped by the actual governor's office, and I think Bethany had a lot to do with that too. After that, they decided to put together a committee, which Bethany and I both served on, and we met several times to try to reconcile those to make it better, and we did a lot of really good things. I bring that up because after that was stopped, the next thing was, okay, since we're not going to be able to get money here, Let's go after where the expenses are, and that's the hospital care and the health care. And so what they said then is, okay, it's got to be this, or we're going to regulate you. Well, I do not believe we should be doing anything that takes money out of the hands of those who are caring for people, and having to have the medical nonprofit environments have a system by which they get overlooked over by the state, and then we can say this or that and micromanage them. The state's terrible at managing their own money. I don't think that would be a good idea. Not to mention, one, it pierces their corporate veil. They're nonprofit, but they still have a corporate veil, so that you put these two things, everybody's starting to watch us start pinching the corporations. That's not good. And secondarily, I believe in the capitalist side of it, not the regulatory side of it. I would rather bring the pharmaceutical companies, the insurance companies, the hospitals, the hospitals, pharmaceutical, insurance, and there's another field I forgot, but there's four of them I have written down. Bring the four groups together. Let's have them. Oh, and the nurses and the doctors, the medical society. Bring them all into one room.
The medical society is not doing a really good job here in Delaware, but you can include United Medical ACO. We would be part of that.
That's a better. Very good point. Yes, and honestly, who was helping me with this is Bethany. She's the one who knows how to try to get to the right solution the right way. So my only point is, problem resolution is done one way in politics, because unfortunately many times a politician is then doing what they need to do to go to the next position and the next position and the next position, and whether somebody's motivated to go to Washington or not, it does affect their decisions. I've got no motivations on going anywhere. I don't really mind upsetting anyone, as long as we get a fair path forward, that everybody gives a little bit and everybody's part of a solution. That's my style of management. And I think with the medical costs and the style by which we try to help, we're hurting more than we're helping. For instance, if we put in a medical school in Delaware, right? Okay, well, we can go put money up and put a whole new medical school in. Okay, now you're going to get the current higher education environments upset. Or you're going to put it in this, Newcastle, Kent, or Sussex. Well, then you're going to get every county upset. So why don't we bring the counties to the table, bring the hospitals to the table, bring the secondary educational facilities to the table, and say, we're doing this, and the state's going to offer support and guidance. How do you all see this going? And work on it as a team. That hospital bill came out of left field from a different state where it didn't even prove out working over long term, and dropped into our state. I don't mind bills coming into our Senate that aren't perfect. Our job is to discuss that and make them perfect. But for them to then take a political motion that hasn't been done in the House of Representatives, I don't think ever, maybe once or twice, where 5 people come up and stop discussion. They stopped 3 legislators, 1 Democrat, 2 Republicans, and all the people from the profession who wanted to still speak from speaking, and rushed that to vote. Right there, even if I loved the bill, I would have voted against it. But then with the concerns about it piercing the corporate structure, then with the concerns about it not really being vetted and correctly done, and then with the concerns of certain people on the other side saying, well, we need to put it here so we have a place to negotiate from. You don't pass a bill and then have a place to negotiate from. You negotiate and make a bill good. As the minority leader for the last years, my top priority was simple. I learned a lot about bond. I learned a lot about JFC, but my top priority was to create an environment where we, as the 15 members of the House Republican Party, are obligated to avoid unintended consequences. And even if we had to vote for a bill that maybe we didn't like totally, if they modified it and made some amendments to make it less, have less unintended consequences, we would vote for it. This year, 6 times, counting that hospital bill, we passed bills that the lawyers from our side definitely said it was unconstitutional, and the lawyer from the other side said they could understand why the other person says it's unconstitutional. All 6 of those went to court. 5 of those all were deemed unconstitutional. You know who paid for that? you and me and all the taxpayers because we had to defend the state of Delaware in court for a bill that we knew wasn't constitutional. So now what's happening? The medical bill is in the same situation. And for what we've been told, it's going to be deemed unconstitutional also. So you not only didn't solve the problem, you created a lot of angst that you didn't need, and you've delayed even discussion on a solution until we get the ruling from the judge. This is not the way to run a government, and Delaware's never done it this way.
So I agree with some of the things that you said. Like the big government is always problematic. So
I agree.
You know, and one of the things that kind of more appealing from your background is you can have different positions from your party based on what's important for people, like reproductive rights. I'm sure some Republicans, friends of yours, are not happy about your position, right? So even with the LGBTQ population, you have a different stand on that than the overall Republican Party. Now, with this healthcare expenditure, outside of this, bigger government, the big issue is hospitals being labeled as nonprofit, but in reality, in 5 fiscal years of Christiana Hospital, their total profit is $1 billion. So that's even in the COVID time, they made 1 year they made $380 million.
Yes,
that's kind of out of control.
And I would not disagree with you, but I'll use my little Catholic boy upbringing. Like if the teacher was writing on the board and she heard someone speaking in the back, she had two choices. Try to find out who it is, and if she couldn't, she made everybody sit there and everybody be punished for what one person did. I'll use that analogy in this situation. I don't think a environment with one particular entity within the medical profession should then deem expenses and even more egregious expenses because they're smaller and they can't afford them for everyone else simply because of one thing was done differently. That's why I would suggest all the medical facilities would bring in their players, all the pharmaceutical, because there's a lot of cost issues with that, all the insurance companies because there's cost issues with that, and let's wrap it around and solve it all at once and put parameters. This is my point. We need bumpers. Just stay within the bumpers and we're good. And I would agree with your concern, and I've actually vetted that concern to everyone during this whole thing. But all I continue to say, but this is not the right way to get the solution. You don't just have a pre-made bill that you push down everybody's throat and you kind of go through the shenanigans. And they created so much animosity and so much stress and so much vigor. We all easily could have agreed on maybe a potential issue. And I even think the one entity that you mentioned were even in agreement and saying, yeah, we can do this differently. But we didn't even go there. And I just think we could have done a better job.
While Dr. Katz is signing up, as he joined us before, I believe end of last year, he was with us, and he is someone who brings a wealth of experience from healthcare field and the perspective of the politics from a physician standpoint. We do value his opinion, especially when we look at the number of years he spent in the healthcare field, but also not just he's a physician, but he's a family guy with being a dad, having 3 kids, being a husband. So all those, and he's actually doing a very challenging campaign by not doing any fundraisings and trying to do this big, important challenge on his own. And we asked him to join us to give us updates from his campaign and where he is. Dr. Katz, how are you doing?
Hey, good afternoon, Kamal. It's nice to see you again.
Nice to see you as well. Thank you for joining us.
Oh, my pleasure.
So we have only 10 days left to the elections. Things are kind of shaping up. You didn't have to go to the primary elections since you are independent, right?
Correct. Yeah,
So,
I'm the 2024 independent nominee for U.S. Senate. So As a minor party member, we're nominated within our party, and in fact, there were no primaries for U.S. Senate this year for the in the Democratic Party or the Republican Party. They were essentially anointed by the parties themselves.
So, Dr. Katz, one thing that I would like to bring up with the primaries, one of the concerning things that I have seen is the turnout. And I specifically checked, we usually have lower turnouts anyway as a country, even for the main elections. It's never really high. Like, as you know, the country that I was born and raised in Turkey, the turnout can go up to 92%. In fact, in their last election, they were at 86, and they were blaming the turnout. So the 86 is a really low number for them. That would be a dream for us here. And in this one, what was interesting to me was in 2020, it was 32%, and now it's down to 20% for people to show up for the primary election. Do you see any concerns with that? Do you think that's going to reflect also for the main elections? There will be less people are going to go and vote. What's your opinion on that?
Well, I can tell you the two issues: the primary elections and the general election. It's unfortunate that there is a low voter turnout in the primary elections. In Delaware specifically, we do have some challenges because we have closed primaries. So we lose about a third of the voters in Delaware primaries because they are not registered as a Democrat or a Republican. And you can only vote in the primaries if you are a registered Democrat or Republican. And in fact, in the general election, which we are now already beginning, about 2/3 of Delaware voters vote as independents. They vote on the candidate that they think is most qualified. But in the primary, it's a challenge and it's a problem. And it's not only because of the closed primaries in Delaware, but also because I think our educational systems don't really teach our kids civics, and it's not a focus in our schools, the importance of our democratic process in our republic. So it's multifactorial. A lot of issues that impact over time the low voter turnout in the primaries.
See, now since the last time we have seen you, and this is all honest. I want you to do well, but I also know that you're going to have a lot of challenges. But especially when the money is a factor in this, because your opponents raised almost $9 million. That enables them to do a lot of things, and a lot of people, unfortunately, again, it's kind of sad. They don't necessarily do all their due diligence, and they just see someone on TV and they go with whatever they see. They don't even kind of validate, verify. There's no checks and balance. So this is kind of like dangerous for these types of situations. So now you having not only going against Democrats but also for Republicans, I would like to know how you are doing so far and what you are expecting from next week's elections.
Well, there are a couple issues in that. First of all, actually, voting began today at 11 a.m. in Delaware. We have early voting that starts today, goes all the way through November 3rd. There's a day off for the general election to be set up on November 5th. But we're actually doing very well. There are a couple issues that I'll get back to as far as our decision not to raise any funds. But we actually just have our data shows that actually we're locked in a dead heat, a statistical dead heat with Lisa Blunt Rochester right now with a 2.91% margin of error. So we're actually doing very well. The most Delawareans at this point are really just essentially exhausted by all of the hate up and down the state. We've heard that for months now. The Democratic and Republican parties want us to essentially hate each other so that they can divide us and keep their power. And the bottom line is the American political system, it's broken. It's grounded on tribal politics, money, and the core value of winning. And the Democratic and Republican parties are really, I believe, and many Delawareans believe, are the root cause of our divisive and dysfunctional government. So we're actually doing very well. We've had a really good grassroots campaign. I mentioned that we refuse to accept any donations. As an independent, I'm working to eradicate the influence of money and corruption in our government. Because we're not raising money, we are a completely volunteer, citizen-driven grassroots campaign that's working to put citizens back in charge of our government. And we've had a really good response with that. It's really citizens have literally come out of the woodwork, and we have built over the past several months a grassroots army, and it's really energized, and we're doing very well, and we're peaking right at the right time.
Now, Dr. Katz, do you feel like I know you are independent, but if you were to support one of them, are you closer to the Democrats more than the Republicans, or is it the other way around? Like,
oh, and that's people try to, and that's really by design with the Republican and Democratic parties. They want to divide us, so it's very tribal. They want us to be you're either with us or against us. And my feeling is we're all on the same team. We're all Americans. We're all Delawareans. And the job of a U.S. senator is a very serious, complex, and important job. And we need to make sure that we are electing strong, independent leaders who are able to critically think to solve the serious problems our country faces. And we have a leadership crisis in Congress. So as an independent, I'm working to change our political system from political governance by politicians to governance by servant leaders, leaders who step forward to serve, placing people above party, service above self. And servant leaders also abide by a code of conduct grounded on our foundational principles of our Constitution, liberty, justice, and equality for all. And we also abide by a behavioral code of conduct in which we recognize our common humanity, where we're respectful of each other, we work for and seek unity, and we work together with all Americans to solve problems. So my feeling is, and not only my significant executive experience in the healthcare industry, but in business, and I also served in the Delaware State Senate and have significant experience going back into the 90s, work on state and federal policy. So my feeling is we're all Americans. We should be stepping up to serve and solve the serious problems we have. So I don't look at party. I just look at how we bring people together to solve the problems our community and our nation faces.
That's fair. Thank you for that. So I agree with most of what you say, because problem is when you look at financial issues, you can be on the Republican side a little bit more. I'm speaking for myself. So, but when it's the social issues, then we are more on the Democratic side. So then you really don't have to be one, because you can't, because you still have the feelings on these issues, opinions on these issues, and also when it comes to social problems. Like our office now is in downtown Wilmington, and we kind of have a little bit different experience with the homeless population in the city of Wilmington. And when you see that problem, you can't help but see what can be done from the welfare standpoint to keep those individuals off street, so then they can actually have safe shelters. And some of them, they actually in front of us, they do drugs. I mean, I have a video of one between the two buildings. The guy is injecting himself on the streets. So those are kind of like the issues that we see. But what's the most pressing problem that you would kind of handle first if elected after November 5th, November 6th?
So there are two categories of issues. The first ones are structural, and then the policy issues. With respect to structural issues, the first thing I'll be introducing, it's already drafted, is term limits. The reason for that is I believe that serving in Congress, the U.S. Senate, is a form of service. Many people step into, once elected, they create a career out of being in the U.S. Senate or Congress and build enormous wealth. So I believe in term limits. I will be introducing that. And I actually introduced that in the state Senate when I was serving in Delaware State Senate several years ago. The second structural issue deals with an overhaul of our federal government, looking at the operational efficiencies and making sure that we streamline our federal government, prioritizing the services that we need to provide, and making sure that we're doing things more efficiently, lower costs, higher quality. With respect to policy, there are three pillars to my policy. The first one is economy, jobs, cost of living. That's one. The second is healthcare, and the third is education. We have problems in all three of those pillars. They're all interconnected. So to solve one problem involves the other issues. And you bring up an issue of drug problems. That's in healthcare, we deal with patient care and solving, as a physician, solving upstream root cause problems of patients. We don't, just treat symptoms. We want to get the root cause of the disease. So when we look at, for instance, issues with drug abuse, that is very complex issues. It's a downstream issue due to socioeconomic issues, education, mental health. And so there are a lot of things that we have to deal with that. Also deals with education. So a lot of the social issues, I believe we need to not only address the acute issues we're dealing with now that society has failed to prevent, but also work upstream and making sure we're solving the issues and making sure we're having healthy pregnancies, healthy babies, and making sure that those children are able to have early childhood education starting within the first weeks or months of birth. Because if you wait to 3 or 4 years, when they're 3 or 4 years old, you've already missed that critical period of time. And as a pediatric critical care anesthesiologist, I know that the first 2 years are critical with a lot of rapid brain development and neurodevelopment in children. So we can't miss that opportunity in making sure the kids have healthy diets, deals with living in safe homes, public safety and so forth. So it's all interconnected. With respect to the issues, I have these things ready to roll. I think Delaware is a perfect place to initiate or to launch these programs with education, healthcare reform, and also economic changes that can help people benefit from the opportunity to work and to be able to advance themselves economically.